Hello, everybody, and welcome to the Tuesday edition of Video Clips, which is brought to you by Wellness Forum Health and the Wellness Forum Institute. So, a couple of announcements. First of all, the fluoride workshop is next Monday. What you need to know about fluoride. Some people say it is the best public health achievement of all time, and other people say it's a poison. I have spent a lot of time on this, dozens and dozens of hours. I have over 130 slides to share with you about this topic. So if you want to register, there's still time for this. Annual pass members don't have to register. You're automatically registered and it's free for you. Okay. Second thing, this is free stuff coming up here. Our annual Prevent Cancer campaign is underway. You runs through October 15th. So we have a couple more weeks left. You sign a pledge card that you will learn about how to prevent cancer. It's much better to prevent it than it is to figure out what to do about it when you have it. So you sign a pledge card, and in return, we will give you a very generous gift coupon towards some of our programs, and also an invitation to a free workshop on how to prevent cancer. And I'm going to cover some things that I haven't covered before, like the organic versus inorganic, not organic food issue. And should you be concerned about plastics and things of this nature? Where do you get the most bang for your buck in terms of cancer prevention? I'll hold that workshop a couple different times, and then of course we'll record it because no matter what time I hold whatever I'm doing, somebody can't come, and we always record everything. Okay, so and in addition to that, in addition to the Prevent Cancer campaign, I have this wonderful report I put together that you can pass on to cancer patients called Informed Decision Making for Cancer Patients. And I'll send that to you for free. Pass it on to people who you think would be helped by it. It gives a very good step-by-step what you should do and things you shouldn't do as well. All right. So feel free to ask for that when you sign up for the Prevent Cancer campaign. One of the things you can use your gift coupon on is our upcoming conference in the fall. No, it starts October 31st, runs through November 2nd. Every week I'll talk about a speaker. We have a whole lineup that's just fantastic. And you can go to our website at wellnessforumhealth.com and click on the conference icon, and you'll be able to look at all of it. But Dr. Carol Gifford, our favorite veterinarian, is going to talk about dog and cat nutrition. So for those of us who have furry children, Winston is my furry child, you'll get all the great news on how to best take care of your pet from a nutritional standpoint. So that's just one of our many speakers, and she'll be first up on Friday. All right. So I've got a couple of news items to share with you today. And the first one involves correspondence with subscribers. I've been trying to include as many of these as I can because so many of the emails I get are about topics that are interesting to everybody. So I've been talking a lot for decades, actually, about how unreliable and even dangerous our healthcare system has become. And there are two types of emails I get from people about just general what to do. One is people who say, listen, I know that if it's an emergency, I have to go to urgent care or the emergency department. I know that I have to see doctors to get my prescriptions refilled or a nurse practitioner. How can I do that more safely? And then other people say, or ask me, you, Pam, do you ever visit doctors for checkups, and what's your recommendation for others? All right, so the answer to the first question is that unavoidable interaction with the medical system due to emergencies and procedures is indeed fraught with risk. Now, one thing we're working on is a solution that we're going to offer as a benefit of helping our nonprofit to provide a consulting service for situations like this. We realize the need. And the types of situations are too varied to detail here. So stay tuned for more information on this as I move through my very long to-do list. If you happen to be a concierge member at Wellness Forum, talk to your provider if something like that happens. But in general, this is a very special category of assistance that's needed, and we want to be responsive to it. And I have some ideas about how we can do that. The second part of it's much easier. First, I'm very transparent about my own choices. I haven't seen a doctor in decades, and I'll do it if it's necessary. If I had a symptom that didn't resolve in a reasonable period of time and I found concerning, But I don't see any need to start hunting for problems when there just aren't any. I'm going to be 68 next month. I don't take any drugs. I feel great. I sleep like a baby. I can still run for an hour. I don't have any symptoms of anything. I weigh what I weighed when I graduated from high school, only I'm more muscular. I'm actually healthier from that standpoint. I don't know how I can make my diet any better than it is. There's nothing to check out. And I'll add something that I think is really important. I have a lot of confidence in my own health due to the way I take care of myself and also my knowledge about the human body and what goes wrong with it and how to not have that happen. Now, how do I translate that to what you should do? I think one important step for everybody is to get to the place where you are as confident in your health as I am in mine, because you know you're doing the right things, you know what they are, and you're doing them, and you've done them long enough to know you're healthy. One of the things that drives people into the medical mill is feeling uneasy and uncertain about their health status because of their age or because they know their habits aren't so great. And then others start to tell you how reckless you are because you don't hang out with doctors. And so people tell me that your age, you should go see a doctor. But the reason why those comments don't bother me is because I'm confident in my health status. I know what I know that I know. If you do decide, for whatever reason, that you're going to see a doctor and get a checkup or just a physical or something of that nature, here's my advice. The first thing is choose practitioners wisely. In our experience, the more alternative they claim to be, the more bogus tests and diagnoses you're likely to receive. So beware of that. Personal referral is always the best, so ask others. And if there isn't an emergency involved, then you've got time to ask around and see if you find somebody that you think sounds good to you, right? That's how most of us find most good things in our lives is referral. When you make the appointment and before you go, decide in advance what you will and will not allow. Even with blood tests, the more you test, the more likely you are to find an abnormality, and it's more likely as you age. So, making yourself more nervous with what we often refer to as noise, these little abnormalities that don't really make any difference, is not particularly helpful in terms of your health status. Also, decide before you go that you won't take any action without taking time to consider. Many people will get caught up in the heat of the moment. A perceived person of credibility in a respected institution tells you that you need more screening or more blood tests or to take a supplement. Just take notes, get away from the situation, give yourself time to settle in before taking action. One of the most common things I hear from people all the time is if I'd known then what I know now, I never would have, and then fill in the blank. So know before you act. Last but not least, trust your instincts. The other thing I hear is I should never have listened to the voice in my head that told me to get away from this person. And your instincts are probably really good if you pay attention to them. And of course, if you're a concierge member of Wellness Forum, talk to your concierge provider. I want to get into some news about oncologists and treatments in just a second, but I'll just stop and mention something. I posted something on social media that got a lot of response. I discovered that I had yoga deficiency disease. And what happened was that I had not taken a yoga class, I figured out, for 8 days, probably the longest I've gone in a long, long time without yoga. I was up at my place in Port Clinton and I was starting to have low back pain and it got worse. I was even helping myself up out of the chair. And I thought, oh my gosh, this is terrible. I haven't dealt with this for a long time. But I got back to Columbus. As soon as I got back to Columbus, got my body in the hot yoga room for a class. Within 10 minutes, my pain was gone, has not come back since. I mean, literally 10 minutes into yoga class, it started to go away as soon as I started stretching out those hamstrings. And so it reminded me of the importance of staying with good habits. I am not a person who can go for a week or more without yoga because of my past history, having been in a pretty serious accident decades ago. And I recovered with physical activity and yoga. And so I found myself with yoga deficiency disease easily solved by getting my body back in the yoga room again. I am teaching the last virtual yoga class series starting in October next month. So we have a few spots left if you want to join me for that. It's via Zoom. You get a private session with me as part of the class series and access to a platform with the dialogue and that kind of thing. So I just thought I'd mention that. Sometimes even I need a reminder that consistency is very important, and you just can't afford to not be diligent. And that was my bad. And as soon as something started happening and the pain started coming back, I knew I had to do something about it. All right, so it's we're talking about cancer this month, so I do want to talk about oncologists and treatment, and some reasons to be very wary as a cancer patient when you are interacting with medical centers. So, according to a new study, 75% of oncologists participating in a global survey failed to identify one or more conflicts of interest. Now, these were oncologists from all over the world. And since we have members and I have subscribers all over the world, this is meaningful for everybody. And it shows that problems in medicine are not limited to the United States. I think they're worse here than in many places, but I don't know that there are very many places where it's just all swell. Over 40% of the oncologists reported that weekly visits by pharmaceutical reps were the norm. What was even more disturbing is the widely held idea that goodies from these drug reps and companies didn't require any form of disclosure. The goodies included honoraria, gifts from reps, grants to cover travel to conferences, and so on. Only 58.5% of oncologists thought that honoraria were a conflict of interest. Only 44% thought that travel grants were. Even fewer thought that getting personal funding from drug companies, sample drugs, consulting, serving on an advisory board for a drug company, providing expert testimony about a drug on a drug company's behalf, and free food and beverage constitute a conflict of interest. Only 24% of the entire group could categorize all situations correctly. Unfortunately, this isn't the only study that shows that cancer patients should be uber careful. A study published in the British Medical Journal last year looked at financial relationships with oncologists and drug companies and how these impacted treatment decisions. The researchers identified cancer interventions that were discouraged by current guidelines or known to be of low value, meaning that no incremental benefit while being more expensive. Open payment data was used to determine the payments to the oncologists. Here's what they found, not shocking. Oncologists taking payments from drug companies were more likely to prescribe low value and non recommended drugs to their patients. So consider this based on what I just shared with you. Oncologists don't really think it's any problem to take money and gifts and travel grants and all that sort of thing. However, it is a problem because research shows that those who take these types of goodies are more likely to prescribe drugs that, if there weren't a conflict, probably wouldn't be recommended. So some examples, denosumab for castration-sensitive prostate cancer. 2 phase 3 randomized trials found no reduction in skeletal-related events from the drug. It's not been evaluated in this particular population at all. Treatment with bone-modifying agents is therefore not recommended for patients with castration-sensitive prostate cancer, and it's recognized as medical overuse. In other words, it has no value whatsoever. It's prescribed anyway, and one of the reasons is they're incentivized financially to prescribe it. The second non-recommended drug was a category of drugs, actually, granulocyte colony stimulating factors. And what these are used for is, well, among other things, is primary prevention of neutropenic fever in patients who are receiving chemotherapy where there's a very low risk, less than 10% risk that the fever will develop. The National Comprehensive Cancer Network and the American Society of Clinical Oncology recommend against it, yet they were prescribed anyway for breast and lung cancer patients. In the cases outlined above, oncologists were prescribing in spite of guidelines advising against. So I thought, well, what about the actual guidelines themselves? This will really be interesting to you. A 2016 analysis of open payments data showed that 86% of the authors of the National Comprehensive Cancer Network guidelines had conflicts of interest. 84% of them accepted general payments, and 47% accepted research payments. This is really important. Clinical practice guidelines are incredibly influential in medicine. They determine the standard of care. And so what I'm telling you is the standard of care is literally bought and paid for by drug companies. We all knew this, but the degree to which it's permeated medicine still kind of takes your breath away when you're confronted with the actual data, right? So this is why, I mean, obviously, I own Wellness Forum. I'm prejudiced. I think my company is great. I think we do great work, but this is why membership is so important. You can't afford to be uninformed. You can't afford to not know how to sort out what's being told to you to do by doctors and others. So joining is one way for you to learn how. If you're not sure, I have a great video, short video I created that talks about the various things that we offer, services we offer, takes you on a tour of our resources. And if you'd like a link to that video, just send me an email at pampopper@msn.com and I'll send it back to you. So to summarize, fluorides next week. I will put this data that I just shared with you in next week's newsletter as well, because I think you're going to want to see it in writing. The fluoride workshop is next week. Prevent Cancer is going on. Get your pledge card. Time to sign up for conference. All kinds of wonderful things going on at Wellness Forum that you don't want to miss. And the last virtual yoga series of the year starts in a couple weeks. You don't want to miss that either. All right, that's it for today. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you on Thursday with more news.